Is that the cue for Facebook? Okay, I think we're going to go ahead and get started. Hello, everyone, and welcome to Beebe's first virtual community town hall. My name is Tara Simpson. I'm the Manager of Organizational Development here at Beebe, and tonight I'll be your moderator. This event this evening will feature 5 members of our amazing Beebe leadership team who will be answering questions that you, the community, have submitted. This will be a one-way viewing experience, so your microphones and cameras are disabled. We hope to host future town hall events, so please keep sending your questions in to beebehealthcareevents@beebehealthcare.org. Again, thank you for joining us this evening. I'm going to go ahead and turn it over to our first panelist, our new president and CEO, Dr. David Tam.
Good evening, everybody. My name is Dr. David Tam, and I'm the President and CEO at Beebe Healthcare here in Sussex County, Delaware. Welcome to our first online public town hall where our Beebe experts share information and answer your questions about the current COVID-19 pandemic. We are providing this service because we at Beebe Healthcare are committed to doing everything possible to care for our families, friends, and communities during this challenging time. Tonight, you will hopefully learn more about the impact of the novel coronavirus and the COVID-19 infection on Delaware and Sussex County, and what we at Beebe Healthcare are doing to prepare for the surge of patients that you're already seeing in other nearby states. My team and I have been assigned the questions submitted to you to answer. I will start, and then my team of experts will follow with their questions and answers as well. Following that, I will be back to share with you my thoughts as we all work to fight the COVID-19 battle here in our community. The first question I have is, I understand there is a large influx of population not heeding their governor's directives to stay home and instead fleeing from different, quote, hotspots, unquote, states to stay in their beach houses in our area. How is Beebe equipping themselves to handle this, and how prepared do you feel you are to handle this influx? So I'm going to answer that in 2 ways. First, I will tell you that Beebe Healthcare has been working very closely with our elected officials, Senator Chris Coons and Tom Carper, as well as Governor John Carney, and of course our other legislative officers such as Speaker of the House Pete Schwarzkopf, to advocate for our community and do what is best from a scientific and medical perspective, that we all need to practice social and physical distancing and quarantine ourselves if there is the possibility of exposure or infection. As such, the governor did listen to us and other healthcare leaders to do everything he can to reduce the number of people coming to our state and has proclaimed various public health emergency proclamations that have gotten to us to where we are today. As far as equipping ourselves, Beebe Healthcare has always been on the front lines of making sure that we are prepared to take care of not just the residents who live here in Lewis and Sussex County, but also those who work in the area, and then also those who reside here on a temporary basis or come to visit. Our mission at Beebe Healthcare is to take care of everybody who works here, lives here, and visits here. And so this is nothing new for us to share and understand how we take care of all the people that enjoy the beauty of Lewis, Rehoboth, Dewey, and other coastal towns here in southern Delaware. And we are prepared to handle that. Question number 2. Mayor Coons said in an interview with WUSA 9 that Beebe Healthcare informed him over 50% of their COVID-19 patients were from out of state. If correct, that would be a remarkable and highly unusual percentage. Can you clarify or verify that over 50% of your COVID-19 patients are from out of state and are not full-time residents of Sussex County? An excellent question. And I personally had a conversation with Mayor Coons just the other day to talk a little bit about this, because the information about who is infected and who is not, and the numbers actually are things that we submit to the Department of Public Health, who then monitors and communicates to the communities and the residents of Delaware in terms of percentages and such. I can tell you, though, that the information that Mayor Coons had was not entirely accurate, and we were able to clarify with him the information that he had, and now have developed new ways that we can communicate with our elected officials. It's also one of the reasons why we are committed to doing such town halls, so we can make sure that you, the residents, get the information as soon as possible in terms of how best to manage and deal with this pandemic. The third question, what has been since the first appearance of COVID-19 cases at Beebe, and what is currently the percentage of out-of-state patients treated inpatient at Beebe? Once again, I think that's a very difficult question to answer, because things like percentage of out-of-state patients, is that visitors, or is that people who come here 2 months out of the year, or 6 months out of the year, or 8 months out of the year? I can tell you that as a brand new resident to Lewis, after coming here from California almost 3 weeks ago, it is a challenge to identify that. Beebe Healthcare has taken on the responsibility of ensuring that we meet our mission to take care of everybody who comes here, and ask all people, not just residents, but all people, to practice good social and physical distancing, hand washing, and to let us know if they need to be screened and tested for the COVID-19 coronavirus. That information about testing and screening and some of the other things are what we will be answering in the rest of this public town hall. And so, without further ado, it's my privilege to introduce Mr. Rick Schaffner, who is a superb administrator with a background in critical care nursing and is Beebe's Executive Vice President and Chief Operating Officer. Rick, take it away.
Possibly see right now, I'm wearing a cloth mask. I think one of the challenges that we have in terms of dealing with our community is really protecting ourselves, practicing, as David said, social distancing and sheltering in place. That's going to be critical for us as we move forward to fight this battle, in which we are all participating in. So I would strongly encourage you, and you will see some different examples from my colleagues tonight about ways that you are able to cover your mouth, as it were, and in public settings, which will allow us to prevent any possible spread, as the CDC has come out with. I will tell you, however, in a private setting, you don't need to be sitting in a room and have your mask on, so you can take your mask off. Now, there's probably many of you that would prefer that I keep the mask on. However, we will continue forward with the questions. Now, my questions are generated around a variety of topics. We'll start with the screening and testing questions. There's been a lot of folks that have concerns about the shortage of testing. A lot of individuals believe that they need to be tested immediately. There's folks that want to know sort of timelines if they are tested. Let me try to answer the testing questions. I'll walk you through the process that we at Beebe Healthcare believe is the critical one to move forward with screening and testing. First and foremost, we believe that everyone should be screened. Screening is not testing. Screening is really evaluating whether or not you have symptoms and whether or not you present the risk that you would need to be tested. So we encourage everybody to be screened. We encourage people to take your temperature every day. Your temperature exceeds 99.5, that may be a reason for you to contact your primary care physician. If you have a new cough, if you have a worsening shortness of breath, those are, again, reasons that you would want to reach out and contact your primary care physician to determine whether or not you need to be further screened and perhaps tested for the COVID-19 virus. we actually screen all of our team members as they arrive at work every day. So we do that exact screening of everybody that enters our campus. That's one of the reasons we restricted our visiting, and we have allowed essentially two entrances to our Margaret H. Rollins Lewis campus is to allow us to better screen and monitor our team members as they enter the organization. So first and foremost, you screen. If you don't feel well and you contact your primary care physician, you will get those screening questions as well. If you're a patient within our Beebe medical group, any interaction that we have with you, whether you call us or we call you, will involve those screening questions, because that's really how we begin to early identify individuals that may be at risk of having the coronavirus. We have actually set up a line for folks that don't have a primary care physician, and that number is area code 302-645-3200. So if you don't have a primary care physician, rather than going to one of our walk-in centers or to our emergency department, you can call. We have trained providers at that line who will screen you and determine whether or not you require to move forward and receive testing. Again, as I say to everyone, if you're not acutely ill, use that line or call your primary care provider to receive that screening. Don't go to the emergency department unless you are acutely ill. Once you're screened, if you do determine that you need to be tested, we will then move to the next level where the provider will write a note and will order that testing for you. So I know that initially when we set about to do some testing, we wanted to get a quick impact in our community, and we had a screening and testing site that we set up as a drive-through. The tests now are done based off of the screen by a provider, and they will be scheduled. It will still be a drive-through, but it will be scheduled for you to go to a testing location. We currently test at our Long Neck location, at our South Coastal campus on Roxana Road, at our Georgetown location, and by specific prescription and schedule at our Margaret H. Rollins Lewis campus. That's our most limited testing availability. So we've determined through the screening that you need tested. You or your physician has sent you for the testing. You've been tested. Now, one of the things that's critically important is when you are tested, you then need to self-quarantine yourself for sure. So even within sheltering in place, you want to still be away from members of your family, and you await the results of your testing and further results and further instructions from your physician. So the tests will be sent out, and we will then get the test result back to you, and that will allow you the opportunity to either know whether you need further treatment, further quarantine, or if you're able to then continue to monitor yourself, because obviously you had some symptoms that led to the testing, and continue to monitor yourself moving forward. I think that that's critically important. If you have been determined to need to be tested, you definitely need to self-quarantine. And this is really a challenge, I know, for folks, but you really do need to self-quarantine away from other individuals until the test results come back. Now, we know that there's been some issues that have been raised about the length of time it takes those results to return. And so we here at Beebe Healthcare are have determined that we want to be able to do those tests ourselves. Currently, we utilize a couple of commercial labs that have been deemed by the FDA to be able to perform these studies. But we will be adding, we'll begin the testing on that this week, and hopefully be able to initiate that testing here in our local region by the start of next week. We would hope to be doing that by next week. So that's something that we will move forward to. That will give us a much more rapid turnaround. So if you are determined to be needing testing, you'll be in a position that you'll be able to get your test done, and we'll be able to give you the appropriate results as quickly as possible so you can keep yourself, your family members, your friends safe. In addition to testing and screening questions, I also have a few questions around how are we prepared to manage this pandemic. First and foremost, the one question is, how well are our hospitals being prepared for this pandemic? Well, I can tell you that this pandemic is one of the most interesting challenges that I've seen in my 38 years as a registered nurse. It's something that we as a country have not really ever seen or had for a very, very long time, if ever. It's led to, I think, a great partnership across the state of Delaware. That's one of the benefits of being in a small state. So we work with other health systems across the state, and we work, as David alluded to, very, very well with our state government and our federal government, as a matter of fact, because of our work with Senators Coons, Carper, and Representative Blunt Rochester. So I think those are things that really are helping us be very well, as best prepared as we believe we can be. And we also have been planning and working internally at Beebe Healthcare. We have a very, very well-organized incident command structure that we utilize when these types of events occur. This is, of course, different than a typical disaster that we would prepare for, because it's going to go on for a period of time. But this has given us the opportunity, I think, to plan particularly well, and I think we have done a very, very nice job in terms of doing that. One of the challenges that we will all face, though, will be if we don't practice well and we don't do well in terms of our social distancing and sheltering in place, this will cause that curve. You've all seen the flatten the curve discussions, I'm sure, in the news. The steeper the curve, the more challenging it will be for all of the health systems in Delaware. So it's critically important that folks shelter in place and maintain their social distancing. A variety of questions about, are we planning for the influx of patients? Do we have shortages of team members? What's our staffing situation like? Let me sort of walk you through what we believe is, I think, what we think is a very well thought out plan. We have a full 4-phased surge plan that's been developed here at Beebe Healthcare. We are utilizing all of our traditional beds, and we are actually assessing and determining non-traditional areas within our Margaret H. Rollins Lewis campus and our other campuses that will give us opportunity to expand our bed capacity should it be needed. Our facilities team has continued to assess our overall infrastructure, and they are upgrading areas of our facility to account for different CDC recommendations for different levels of care. We review our supplies daily, particularly our personal protective equipment, or PPE. You'll see that discussed a lot in the news. We look at that and actually have a dashboard around all of the supplies that we have needed, our pharmaceutical supplies that we have needed, and our medical surgical supplies that we have needed. I will not tell you that sourcing these items has become easier as this pandemic has grown, but we have a team that looks at this and monitors this on a daily basis and have been doing a great job. We've also had tremendous support from our community, and I know my colleague Tom Protack is going to talk a little bit about that, but the donations that we've had, particularly of the personal protective equipment, has been very, very, very thankfully received by us here at Beebe. Questions about our staffing. Again, one of the things that we've talked about and hopefully has been discussed in other forums is we made the decision that even though we were going to cancel a variety of cases, elective cases, and really begin to prepare to accept patients, we did not furlough any of our team members. We've really kept all of our team members in place, and we've actually begun a fairly aggressive retraining and cross-training program that is going to allow us to be able to staff up as we see the influx of patients start to occur. So it's been a difficult decision for us, quite frankly, because the volumes are really not here that you would see. So one of the other questions is, what's our census like? Our census is probably around 100 when we normally run anywhere between 145 and 150 patients a day this time of year. So our census is down, but we've maintained our staffing complement because we believe that will get us the greatest preparatory time period as we are readying for the surge of patients that are coming in on board. And again, I think if you talk to any of our team members, they will tell you that we have a very well-organized training program so that people are comfortable when the time comes for them to participate in the care of additional patients. One of the questions that I'd also like to discuss is the challenges that we have. As I think folks in the community are aware, a very active obstetrical practice. And so there was a concern from a couple of soon-to-be parents about what was going to happen to them when the time came, should this surge be ongoing. And I think we are very pleased to say that we're very, very well prepared to manage and care for both the mother, the partner that's with them, and the new child, the new infant that's born. We continue to allow one support person in the delivery room. I know that some facilities have not engaged in that, but the CDC still encourages that. So we will screen the visitor as well, and we will make sure that that person is healthy, and then they will be able to participate in the childbirth process. We actually have done with our obstetrical practice, they've actually begun to ask all women who will be delivering to be self-quarantined for the last 2 weeks leading up to their delivery. So that really keeps them away from anybody in the public that could possibly give them the COVID infection. And then again, we follow all the recommendations from the CDC and the American College of Obstetrical Gynecology. All of those recommendations are being very, very well followed by our team in OB/GYN. I have a question about folks that are professionals that are currently working in other areas of healthcare and have maybe not necessarily kept their licenses active. Again, the state has a fairly well-documented process now where you're able to reach out and discuss how to reactivate your license if you're a physician or a nurse. It'll give you the opportunity to again, receive some level of training. I know that some of our retired nursing corps here at Beebe Healthcare have reached out to us and are coming back on to help us prepare for this surge. So there's opportunities for retired or our folks that are licensed from other states that have relocated here and maybe not obtained a Delaware license. You can certainly pursue that as well. And then the last area that I will talk about is really how are we prepared for those things that we keep hearing about on CNN and Fox News every night in terms of the ventilators going to be available, or the drugs going to be available. Again, as I said, we assess this on an ongoing basis. We determine what our needs are, and then we work within our state really to be sure that we are tapping into all the resources that are available both from our state stockpile and our national stockpile, which will give us the opportunity, I think, to expand again. As we need additional ventilators, we're in a position that we can get those ventilators. We do have what we consider to be a very robust stock of those types of devices here at Beebe Healthcare. And I think that we will continue to work with our colleagues at the state to continue to move that process along as well when we determine that we're going to have a need for those devices. And then the last question, and I would hope that people would understand that we would do this, but the last question is, when all of this is over, what are we going to do to decontaminate the hospital? Well, we actually have a very, very solid, hardworking environmental services team, and we are decontaminating the hospital on a regular basis. We routinely clean and terminally clean areas throughout the facility. We've got a variety of devices and techniques that will allow us to continue to move that forward. And I think that we will do a very, very fine job. I am very confident that our organization will be clean, not only during, but of course after we are done with this surge. That's it for my questions, and now it's my great pleasure to hand off to our, I'm checking his title to make sure I get his title correct, our COVID-19 Response Medical Director, very talented and skilled infectious disease doctor, Dr. Bill Chasanov. Dr. Chasanov, take it away.
So my name is Bill Chasanov. I am one of the infectious disease physicians here at Beebe Healthcare. I also work closely with another infectious disease physician that some of you might know, Dr. Scott Ohlweiler, who has been working extremely hard as well. I also serve as the clinical transformation officer here, which allows me to work closely with Beebe's population health team and employee health department as well. I was born and raised in Sussex County, and I came back to the area about 3 years ago, so thank you for having me back. I want you to know that I'm in my office by myself, so I am not currently wearing my mask, but as Dr. Tam and Rick had said, please, if you're in an area where you're not able to socially distance yourself 6 feet from someone else, you should consider wearing one of these cloth masks. So my job tonight is to answer several questions that you posed to me about the virus, how it is spread, along with some treatment options that are out there. So starting with some community members, the other things that they have questions about are immune system issues. If you have a weak immune system, are there special things that should be done? I'm going to do my best, and I hope that I answer the majority, if not all, of your questions. I think that it's important. To talk about the virus first, so we're all on the same page. As Dr. Tam had mentioned, that this is a novel coronavirus. You will hear it named several different things throughout the media and throughout the community. One being the 2019 novel coronavirus, one being SARS-CoV-2, and the name of the disease that the virus caused is actually COVID, COVID-19. So this is a coronavirus. This COVID-19 virus is one of many types of coronaviruses that are out there. It is a large family of viruses. As a matter of fact, most of you have probably had a coronavirus, as they normally cause the common cold. This is different. This is a novel or new coronavirus that was first discussed back in December that was causing pneumonia and some significant illness within the Wuhan community in China. So what is interesting about this virus is that it may act a little bit like the flu, but we're seeing that certain people are actually becoming much more sick and dying from this virus than the amount of people that die from the flu every year. I do want to tell you about some of the symptoms. So some of the symptoms of this virus include fever, shortness of breath, cough, muscle aches, sometimes diarrhea, and interestingly, occasionally a new loss of smell and taste has been reported. It's important to realize that someone may not have all these symptoms. They may only have one or a few of these symptoms. One of the questions I was asked, will you always have a fever? And that answer is no. Some people do not mount what we consider a fever, being 100 or 101 degrees or higher. So it's important to realize that. It's important to discuss how this virus is spread. So this virus is generally spread in a way that we say is from droplets. And what that means is that if someone is ill with a virus and then they go to cough, sneeze, or even talk, droplets come out of their mouth and can spread for up to a 6-foot radius. Hence, when you read about social distancing, they're asking people to remain at least 6 feet apart. These droplets can land on someone within that 6 feet, or it can actually land on an object that is within that 6 feet. If those droplets, which you might not be able to see with your eyes, if those droplets land on you and you accidentally touch that droplet, or that droplet lands right in your mouth or your eyes, or if you even touch your nose, that's how the virus is spread from one person to another. It's also important to realize that if those droplets spread out onto an object and you touch that object and you don't wash your hands after, and then you go to touch your eyes, your nose, or your mouth, you can also spread the virus that way. After someone comes in contact with a virus, it does not mean that they will become infected with the virus, but obviously there is a chance of becoming infected with the virus. Anywhere from about 2 to 14 days after having that contact is when most people will develop symptoms of an infection or symptoms that they have been infected with the virus. The average length of time is about 5 days. So if I were to become in contact with the virus today, probably on average, I would have symptoms generally by this weekend, so Saturday or Sunday. One of the questions I was asked is, how long do these droplets live on certain things? Well, a recent study has just come out that showed that this virus can live on certain objects like copper for just a few hours, but could potentially, in the right circumstances, live on things such as plastic for up to 2 or 3 days. And that's a recent study that has just come out within the last few weeks. Another question I was asked was, this is so similar to the flu, why are we so concerned about this? Well, I agree that the flu is similar to this virus in the way that it's spread. Just like I talked to you about the flu being, by the COVID-19 virus being spread by droplets, the flu is spread the same way. What's different about this is something called the infectivity rate. And what that means is that the infectivity rate of the normal seasonal flu is about 1 to 1.5, sometimes up to 2, where this COVID-19 virus is as high as 3 in some recent reports. So let me put that in terms that we should understand. If I have the flu, there is a chance that I can give that flu to 1, maybe 2 other people. If I have the virus that causes COVID-19, I have a greater chance of giving that virus to 2, if not 3 people. So the spread becomes significantly higher with COVID-19 than with the flu virus. I think this probably leads into the next set of questions, which is what can I do to protect myself? So the most important thing to do is social distancing plus hand washing. What we mean by social distancing is to remain at least 6 feet away from one another as much as possible. If you do have to be out for essential items, such as going to the grocery store, where you may not be able to control that social distance as well, someone is coming towards you with a cart, you can't get 6 feet away, the CDC in the last few days has recommended that using a cloth mask will provide some protection. So I do recommend that, and I think that everyone who is on this panel will continue to recommend that along with the CDC. I know that Mr. Schaffner showed you his cloth mask just a few minutes ago. You can make these cloth masks really out of anything. I am not one who sews, but you can make this out of a t-shirt or a bandana. If you do have internet access, the CDC website will actually show you simple ways to make these masks. The other thing I alluded to is washing your hands frequently, meaning that you need warm to hot water, but does not and should not be scalding water, and just good old soap. It does not have to be a special soap, and you want to make sure that you're washing your hands for at least 20 seconds. The other important thing to do is to avoid touching your face. It's hard to imagine how many times that we all touch our face, especially those of us who wear glasses and we readjust and things of that nature. It's important to make a conscientious effort to not touch your mouth, nose, eyes, or face. If you do have to touch these, please wash your hands before. The other important things to do is if you know someone is ill, you want to try to avoid them if possible. That also goes for you. If you're feeling ill, you want to try to avoid situations where you might be around other healthy people. I have been asked a few questions along the lines of what I call the livability of the virus, meaning where can this virus live? One of the questions I get asked commonly in the hospital is, can this virus live on my hair? Well, technically, those droplets that I discussed could end up in your hair and could live there for some time. I do not know how long they can live there. There are no studies that really show me if this is hours to half a day or a day. But what I do recommend, at least for us in the hospital, is that if you have longer hair, which I do not, but if you do, you want to pull that hair back to keep that away from your face and so that it's contained. That's one of the ways that you can help protect yourself. If you do have to touch your hair or adjust your hair, you want to go ahead and wash your hands after that as well. That will help to keep you safe. Another question that I was asked is, can the virus live in refrigerated temperatures? I'm going to answer this question that the normal refrigerated temperature is around 40 degrees. And the preliminary studies of looking how well this virus lives, it does appear that this virus can live in temperatures that are lower than 40 degrees Fahrenheit. So I would answer that question that that is a possibility. The concerns about our community members who have weakened immune systems, which could be secondary to certain diseases like cancers, autoimmune diseases, or even because of medications that we're giving people to treat certain diseases, such as steroids or some of these medications you see on TV like Humira, on those commercials, they can decrease your immune system. What's important about that is that it doesn't increase your risk of getting the virus or getting the infection, but if you were to get the virus or the infection, you are at an increased risk of potentially becoming sicker than someone who did not have that disease or someone who was not on those medications. The main risk factors of having complications or becoming more ill from COVID-19 includes age of 60 or greater, having chronic heart disease, chronic lung disease, actively having cancer or other diseases that weaken your immune system or being on medications that weaken your immune system, having diabetes, with uncontrolled diabetes being worse than controlled diabetes, chronic kidney disease, and high blood pressure. So if you do have those risk factors, you are not at an increased risk of getting the virus, but you are at an increased risk of getting sicker than someone who may not have those risk factors. The last group of questions that I have is, what happens if you become infected with the virus? Well, the first thing that we ask is that if anyone starts to develop symptoms of the virus that I discussed a couple minutes ago, we ask them to self-quarantine themselves. If you feel that you need medical attention, I want you to seek it. I don't want you to put yourself in a room and not get the help or the medical attention that you might need. But if you don't feel that you need medical attention, please try to self-quarantine yourself. What I mean by that too is that if you can be in one bedroom and use one bathroom and everyone else that you may live with is able to stay away, then that's what you should try to do. If you are unable to separate, for instance, if you live in a place that only has one bathroom, then please make sure that you're cleaning the bathroom after you're using it so that someone else has less chance of getting ill. Again, I can't stress this enough. If you do feel that you need medical attention, please seek medical attention. I would ask that you would call ahead to let someone know that you're coming in so we make sure that we take the precautions to keep you safe and to keep all of us safe as well. So along those same lines, one of the questions I was asked is, we know that as we get older, we have a greater chance of becoming hospitalized and a greater chance of becoming more critically ill than those who are younger. So the question really here is that it's important to note that everyone who becomes infected, no matter what age, does not mean that they are going to become critically ill from the virus. But what we have found, and the CDC has recently published, is that those who move through life, I like to say, or as we all become older, they do have a greater chance of having of being hospitalized. And then if they are hospitalized, they have a greater chance of requiring the ICU or critical care. And then they do have a greater chance of actually dying from this disease. So I'm going to show you a chart that came out about a week and a half ago from the CDC. And I don't expect you to look at all these numbers. But if you can look over here on where I drew the arrow on what is, which is on this side here, this is all by age. So that's 0 to 19 years, and it goes all the way up to those who are 85 or older. If you can compare that to the arrow here, this talks about how many people need to be hospitalized that have confirmed COVID infection, how many require ICU admission, and then out of those, how many unfortunately passed away from this infection. And those numbers continue to go up as your age goes up. So that's really important to know. With that being said, it's important to socially distance yourself. It's important to keep 6 feet away, as we talked about, as Dr. Tam likes to say. You need to keep a hockey stick away from everyone if possible. It's important to wash your hands and wash your hands appropriately and frequently. It's also important to make sure that you avoid touching your face as much as possible. We know that people are going to get sick from this illness. We know that. What is really important to know too, I'm going to show you my last visual here, my last chart, if you will. If you can see this chart, there's a red peak over here that comes up to here, and then there's a blue that has a very smaller peak under here. In the United States or anywhere, I drew this yellow line across. This is the amount of resources that we have in the entire United States to take care of people who are sick. If everyone gets sick at the same time, we're going to have a massive need for those resources, and we're going to be over this yellow line, which means that we're going to have all these people that need things that we're not going to be able to give them. If we social distance ourselves and we keep this infection, if we keep this infection from not infecting everybody all at once, we'll be able to hopefully stay under that yellow line and provide all the resources that we have in the United States to keep everyone as safe as possible. I think that I've probably taken up enough of your time, and I hope that that was helpful. What I'd like to do is pass you off to my friend and my amazing colleague, who is Mrs. Marcy Jack. He is the Vice President of Quality and Safety at Beebe. Thank you for your time.
Hello, my name is Marcy Jack. I'm the Chief Quality and Safety Officer at Beebe Healthcare. Yes, I'm not a cowboy. I'm not playing one today, but I wanted to show folks that you don't need a fancy cloth mask to be able to protect yourself. So let me go ahead and take this off, however, because I am alone in my office, so I'm not needing to worry about social distancing right now at this time. But again, this is a cloth covering, not necessarily a cloth mask. I don't want folks to think that they need to have access to sew something or try to find a cloth mask from somewhere to use. And I'll talk more about that in a minute. So again, my name is Marcy Jack, Chief Quality and Safety Officer at Beebe Healthcare. I've actually been at Beebe for about 20 years, over a 26-year time span. I started off practicing as a nurse, and then I went to law school and practiced law. But then I returned to healthcare because my heart has always lived in healthcare. And now my focus is in risk management, safety, security, quality, infection prevention, and emergency management. So I have received many questions of asking about folks in our community and the public wearing face masks as well as gloves. So let me start talking about the masks at first. The CDC, as Dr. Chasanov mentioned, the CDC released new information that encourages members of the public to wear cloth face coverings because we now know that a significant portion of people that have COVID-19 may be symptomatic or not have any symptoms at all. Or what they may do is actually pass on the virus before they develop symptoms. So the virus can spread quickly between people in close proximity. And again, that can be through coughing, sneezing, or just talking. So the cloth face coverings that are recommended are not surgical masks. They are not N95 respirators. CDC still would like people to make sure that we have those protective pieces of equipment for our healthcare workers and other first responders, because those folks are certainly at very high risk of contracting the COVID-19 virus. So, please don't seek out anything that's an N95 respirator or a surgical mask, but you can, again, potentially make your own mask. Again, you don't have to have any sewing capability. I know I don't have any, so I'm looking at the CDC templates and figuring out what to do for myself and my family. So if you do have questions on how to make a face covering, again, I'm just going to show a couple of visuals. I'm not going to show you much because they're on our Beebe Healthcare website, but it does show this one has a coffee filter that's used. Because one of the questions that was posed to me was wondering about HEPA filters and cutting HEPA filters and putting them inside these masks. You don't need anything fancier than what you have in your own household to make these cloth face coverings. So if you want to look at Beebe's website, you'll see instructions on there how to access the CDC website, which
gives you instructions like I just showed you on the screen. So for those of you who are sewing away and donating masks to Beebe Healthcare, please continue to do so. We really do appreciate it, and we still need those cloth masks. So also you can find instructions on how to make those masks and how to donate those masks on our website for Beebe Healthcare. So now let me address the question about gloves, because this is a good question, and I'm not sure that many people know sort of the guidance that kind of goes with glove wearing. So I went ahead, here's my visual. Okay, I have these gloves on. And what we can find is that using gloves really is not encouraged by members of the public because it can give you a false sense of security. So great, you put your gloves on, I'm gonna go to Walmart or I'm pharmacy, and I'm touching all kinds of things. I'm touching lots of different objects, and I'm not doing any hand hygiene in between. I'm thinking my gloves have got me and I'm protected. So when you go to remove the gloves, that's when you can see that there's a problem. So, okay, now this is all full of potential contamination. How do I take that off? So do I pull it, pull everything like this and try to take it off? That might work, okay? If I go like this, I'm gonna take these off like this. Well, now I've just contaminated my hand. And then, okay, how am I gonna get this one off? This is dirty, 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 dirty. This is all dirty. So now my hands are very contaminated and I need to immediately do hand hygiene. So if folks are going to wear gloves, again, what we say is don't wear gloves, because then you're actually more cognizant of what your hands have touched, and you're probably more willing to either wash your hands with soap and water or use a hand sanitizer before you accidentally then touch, again, some mucous membrane of your face, your eyes, your nose, your mouth, or something else. Or again, you come home and you touch everything, and then maybe your family member touches those things and then contaminates themselves. So again, the best thing to do is practice frequent hand hygiene measures. You want to wash your hands with soap and water. You can sing happy birthday twice. That's one way to kind of meet that 20-second guideline. And always also clean with that running water and soap underneath your fingernails. That's a spot that can harbor the virus. Clean under your fingernails as well. And that goes also with hand sanitizer. Make sure you use at least a 60% alcohol-based hand sanitizer. There are some hand sanitizers out there that are alcohol-free, and that is found to not be effective against the virus. So please do know that wearing a cloth face covering and practicing hand hygiene absolutely does not replace the strict social distancing that we need you to do and keep doing. Social distancing, which many folks now are saying it's really physical distancing because we're trying to continue to be social. We're social creatures. This is very difficult for everyone. So, you can replace the word social if you'd like with physical, because that is what we're really talking about, is practicing physical distancing. Please be sure to continue to shelter at home, except for when you need to go out for your own health purposes. And think of it that way. What is a must-have that I need to do to go out to be amongst other people versus maybe a nice to have? So again, if it's your own health needs, you need groceries, if you need medications or something from the pharmacy, or if you work in an essential business, that's going to help save other people's lives. Then please continue with that 6-foot distance. Use your face coverings and practice that hand hygiene frequently. We do have many holy holidays that are approaching. They're coming up. We start with Passover, we have Easter, we have Ramadan. All of those are taking place in April. Ramadan goes into May. Please be sure to continue practice social distancing at home and remaining 6 feet apart from everyone. It's going to be very tempting to have family gatherings. I already have, a little bit of a space in my heart because I will not be able to gather with the folks I'm used to gathering with over the holidays. But please just keep your family unit that you've been sheltering in place with, have a great time with those folks. And also, many places of worship have worked out ways to worship remotely. So take advantage of those great creative ways to remain together spiritually, but while remaining apart physically. You can use FaceTime, Skype, good old-fashioned telephone, write letters to your friends and family members. Everyone loves to have, a letter in the mail that gives them well wishes, something we don't, do as often anymore, but we have to be creative, try to find ways to be together, but not be together physically. As you heard earlier in this town hall by, I believe, everyone, and Dr. Chasanov showed you a visual, we're preparing to have a surge of patients who need to be hospitalized. We could very well see a second surge of patients following this week of holidays if people relax and stop following the strict physical social distancing requirements that are in place now. So I'll use the same thing that Dr. Chasanov used. And as you see here, this is what he talked about with that surge that we're trying to prevent, and we're trying to flatten the curve. However, if we see that we're going to lighten up on our social distancing and have everybody get together this weekend or the weeks that come up, or even starting in a couple of days, this is what we might see. We may see a second surge, and that is certainly something we don't want to see. So thank you so much in advance for doing what it takes to keep yourself and everyone in your community safe. It can be so hard not to physically be around those that we love. But please know that by sacrificing physical closeness now, you are certain to save lives in the future. So thank you very much. I'm now going to turn you over to Mr. Tom Protack, the president of the Beebe Medical Foundation.
Good evening to all our listeners. I am speaking to you tonight from the historic home of Dr. Richard Beebe, who with his brother James founded our hospital over 100 years ago in 1916. I am speaking to you tonight to thank you for participating and to also thank all of you who have reached out to us to donate in so many ways. A special thanks to all of our strong and loyal donors who always support Beebe no matter what the case. But a very, very special thank you to all those who for the very first time have made a gift to Beebe during this COVID-19 crisis. I was asked to answer the question, how can we help? That question has come in so many different ways, and we here at Beebe have been fielding those questions and trying to organize them to get you some answers. The easiest way that you can help us, number one, is to follow all of the CDC guidelines and the state restrictions by staying home. All the things my colleagues have said before this are so important and true to stay home and to stay safe and to stay well. Other ways that you can help us is go to bbhealthcare.org. On our website is the COVID-19 Relief Fund, which explains all the countless ways that you at home can help us out here at Beebe. The first way is by donating medical supplies. Countless people have dropped off at our population health office right on Savannah Road medical supplies, masks, gloves, cleaning materials, so many things. If you do have these materials in your offices, in your shops, in your garage, please continue to drop them off. Other people have been making masks, as Marcy Jack said. I have my mask here, and I am not wearing it because I'm the only one here this evening at the Beebe Medical Foundation. But wear your masks when you are out in public, if you really, really need to go out in public. But if you would like to make masks, on the website, you can click on one of the buttons and it will give you the directions and how to make with materials and how you can drop them off and we will distribute them. The other ways people have been reaching out to us, they have been giving us billboards, they have been donating storage for us for our supplies, so many ways that people are reaching out to us. Another way that people have been donating to Beebe is they're really concerned about our doctors, our nurses, our frontline care, healthcare workers, and even all those who are in the system. As Mr. Schaffner said, Everyone is still employed full-time, and everyone is working and being cross-trained and moving to different locations. And people want to feed the fight. They want to feed our team members and let them know that a good meal is coming their way. So a grassroots effort has come up through our restaurant community and local business owners called Crush Corona. And they are asking people to consider making a $25 donation to your local restaurant to purchase a gift card that we will then distribute to our Beebe team members. If you don't want to go out in these next couple weeks, which we are encouraging you not to do, you can easily go to our website. You can make a $25 donation or higher in increments of 25, and we here at the foundation are going to purchase gift cards from our local restaurants in bulk. This will do a few things. It certainly will feed our Beebe team members, but it also will help our local business and restaurants who support us all year long. They are our donors also. They sponsor our events, and we want to help them out in this time of need. Since this Crush Corona initiative has been started, they have their own Facebook page, #CrushCorona. And this program started last week, and I am happy to say that today, over 500 gift cards have been donated. We want to get a gift card for every one of our Beebe team members. Our goal is to get 2,900 $25 gift cards. So please help us feed the fight. Go online tonight and make a donation. The other way that you can help support Beebe during this time of need is to make a direct financial contribution to the COVID-19 Relief Fund. This fund has been set up to help Beebe with our incurred expenses. As you can imagine, our materials, our PPE, all the things that are costing us extra to battle this fight. We also are happy to say that we have purchased new testing equipment that will be coming very soon, where we here at Beebe in our hospital will be able to do rapid testing. We are going to purchase that equipment and that technology with the money that is raised through the COVID Relief Fund. The fund currently, I am very happy to announce, has over $370,000 in it. Our lead gift was from the Carl M. Freeman Foundation, a gift of $250,000. We received a $50,000 gift from local Lewis residents Tracy and Scott Ciprell. We received a $25,000 gift from Joseph and Debbie Shell, a $10,000 gift from Bob and Dee Moore, and another $10,000 gift yesterday from Mark and Marianne Ronald. Every gift counts. Every gift counts to help us fight this battle. Your gift tonight will certainly support us in this effort and in this fight. Again, you go to bbhealthcare.org, and on the opening page of the website, you will see a green bar which says, "How can I help the COVID Relief Fund?" Also, ways you can help us is by sharing our Beebe Medical Foundation and our Beebe Healthcare Facebook posts. We are trying to keep you informed. We are trying to share with you all the ways that you can stay safe and that you can keep our team members safe. As I sit here in the chair of Dr. Richard Beebe in his historic home, I am reminded that over 104 years ago, he and his brother started this hospital as a family business to care for our local community. Beebe Healthcare has been here for over 100 years, caring for our families, our neighbors, our friends, and our supporters. We have survived other crises. The Beebe brothers survived the 1918 Spanish flu pandemic. They survived wars. I can tell you, I am so proud of our Beebe team members, our leaders, our doctors, our nurses, all of our staff who are helping us fight this amazing and unbelievable pandemic. They are strong, and they know of your love, your support, your concern, and your prayers. It is now my privilege and honor to bring you back to Dr. David Tam, our new President and CEO.
Thank you, Tom. As you can see, I've changed costumes. We are all evolving here at Beebe Healthcare, using new methods and techniques to address this pandemic. We have employed new visual and video technology, which may not be perfect. As you saw, we have papers that we use for our graphs to show you, but we feel so compelled to make sure that you get the best, most up-to-date information for how we together will fight this pandemic. I've also tried very hard, as you've heard, to keep our employees working here as we try to retrain them and get them to do the different things that we may need them to do as we fight the pandemic and the surge in the weeks to come. I'm also committed to our community and know that many of our caregivers may have spouses or other family members who have lost their jobs as a result of the business changes due to the pandemic. And so when we talk about the gift cards, it is not just for the nurses and doctors, who of course are very important in the fight, but also to every other member of the team, housekeeping, food services, lab techs, everybody who is part of the Beebe Healthcare family to take care of you. I hope that today you have found the speakers and the responses informative and helpful. You've heard about our screening and testing efforts, the science behind our battle plans as we prepare to meet what lies ahead in the very near future, and the details behind some of our surge capacity planning and how we are doing everything to be ready to take care of you during the upcoming surge. You've also heard from Tom Protack about how the community has been so supportive of us and how we actually need so much more support from you so that we can continue to provide health care as well as social and supportive care for everybody here in our community. As I close out this town hall, I want to take this opportunity to let you know that Beebe Healthcare stands ready to take care of you and our community. The speakers you saw tonight represent the 2,600 Beebe team members who are all united in our common commitment to serve you, the community. Today is my 21st day as the president and CEO of Beebe Healthcare, and I am absolutely confident that we will together prevail through the next week and months. With my Navy background, you might have expected me to close with some military quote, but I would like to share with you something Mother Teresa once said. Quote, "None of us, including me, ever do great things, but we can all do small things with great love, and together we can do something wonderful." As I sit here at my desk wearing the cloth mask made by one of our sewing volunteers in the community, I can actually feel the love and support she put into making that mask for us. This connection is what we will get us all through this pandemic. Beebe Healthcare has been your healthcare resource for the last 104 years, and with your support, we will prevail and be here to serve you for the next 100 years. Thank you very much for your attention, and have a good night.